We're getting a lot of questions about what does recovery from COVID mean. We're reporting that people have recovered from COVID. What it really means is that you're at a point of the disease where you're no longer likely to transmit it to someone else. So we have both a clinical definition of recovery and what we call a virologic definition of recovery. The clinical definition of recovery is pretty simple. We take the date that you were either first diagnosed with COVID, either when your symptoms started or when you had a positive test, and then at least 10 days after that, plus at least 3 days without having a fever. And that's very important because it doesn't mean that just 3 days without fever. It doesn't mean just 10 days. It's a combination of that time period plus having resolution of some of the symptoms. So if someone were diagnosed from COVID, let's say they go in and they get a test done and they're asymptomatic and they're doing fine, 10 days later, if they've never had a fever, they're considered recovered. On the other hand, if they got tested for symptoms and they were having a fever and a cough and body aches, well, it may last for 8 days, 9 days, 10 days, 11 days, 12 days that their symptoms are there and their fever's there. It's only when they have those 3 days without fever that they're considered recovered. So consequently, a lot of folks who are having COVID and who are having symptoms may actually be, quote unquote, sick for a period of time that's longer than just that 10 days. And so you need both of those. We also see some folks who end up getting a test done because they're worried or they've had contact with someone else and they're asymptomatic, and then 3 days later they start developing a cough or a fever. Where do we start counting then? Well, we actually start counting where the symptoms start. So it's whichever is later that we're using as our counting point. So the day the fever and the cough starts, that's where we start counting our 10 days. And then afterwards, once that 10 days is done, if the fever's gone away, then they're good to go. A lot of times people are asking, well, doesn't it mean I'm still infectious? And the answer is no. And the reason why we know this is that there have been several studies that have been done that have looked at people who have had COVID and who actually had finished their 2 weeks period of time and still had measurable virus in their nose. That is, they had a test done, and then 2 weeks later, they had another test done. The virus was still there. Yet, when those individuals had all their contacts traced, not a single contact got COVID. So what we know about this virus is that the virus can live in the nose for a very, very long period of time. But it doesn't mean that people are infected. And it's really that time period of somewhere between 10 and 14 days for the most part that really determines whether you're likely to infect someone else. So the short of it is, with regard to recovery, it's 10 plus 3. Everybody has to stay home for at least 10 days, regardless of whether they have symptoms or not. If you have no symptoms, by the time you're done your 10 days, you're done. If you have symptoms, you have to stay home for at least 10 days plus 3 days without fever. So maybe your fever goes away on the 4th day. 7 days later, you have 3 days without fever. You still got to stay home for 10 days. Your fever goes away on the 10th day, then you have to stay home for 13 days. See how it works? On the other hand, if you're asymptomatic when you first get your test, and then you start having fevers, you start counting the 10 days from the day that the fevers start. So let's say you get a test done because someone around you had been infected, you find out that you have it, and you're feeling fine. 3 days later, you get a fever. Well, that's where the 10 days start. So you already have your 3 days, which means that's 13, all right? 10 days, and then you have to wait for that fever to go away for at least 3 days after the 10 days starting counting. So everybody's going to be in quarantine for different lengths of time depending on what their particular situation is. The shortest amount of time we're going to ask people to stay home is 10 days. The longest period of time, don't honestly know. It really depends on how quickly you respond. A lot of people are asking, should I get retested again? And we're actually saying, no, don't get retested, because we know we'll find virus in a lot of the cases, but we also know that it doesn't mean you're going to infect anyone else. Some employers are saying, well, you need to have 2 negative tests. Well, early on, the CDC recommended that, but they've long since backed off of that because of what we know about how this virus is transmitted. So you don't need to get a second or third test just to demonstrate that the virus is no longer there. If you meet what we call that clinical criteria, i.e. that 10-day period of time, plus the 3 days without fever, then you're fine and you can go out and about. We also have some people who say, but it's been 10 days, or it's been 14 days, it's been 3 weeks, and I still don't feel good. And that happens. That's part of this illness. The symptoms of having fatigue, of having a residual cough, of having that sense of feverishness where you just kind of feel icky all over like you have the flu. As long as you don't have a real fever, and by real fever, we mean greater than 101. As long as you don't have a real fever, you're going to be okay. And it doesn't mean that the virus is still there. So, most people we're seeing are actually recovering very well and recovering very easily. The one thing that we would recommend for people to do is that if you have had COVID and you were diagnosed within the last week or so, and you start to see your symptoms worsening, it's very important to seek medical help to make sure that you don't need additional treatments for the COVID, or even potentially need to go into the hospital. A lot of people are asking the health department for a letter to clear them to go back to work. You don't need to have a letter to go back to work from our point of view. For the most part, we're asking people to stay home. People are cooperating with us. We're not legally forcing people to stay home, so we're not legally required to release you. So you can go back to work. If you do need a letter, we can provide one for you, although I've got to be honest, we're getting backed up on those. Also, your doctor can provide you a letter as long as you fit into the CDC criteria that we've just talked about.